Hello everyone, I'm Dr. Rashmi Mahajan, practicing dermatologist at Lajpat Nagar, New Delhi. I wanted to talk to you about skin conditions in children. I thought this is a segment which has not been dealt with that often, so just wanted to give you a few tips and let you know what various conditions a child can suffer from. There are various age groups that the children suffer from various skin conditions. So, just touching these topics and giving you a brief idea as to what you should do and what you should not do. And of course, if things go out of hand, you should go and see a dermatologist immediately because skin conditions can worsen in children very quickly. The first thing you should not do is use any kind of cream or ointment on your own. Please understand these are medicines and not to be used on your own without the reference or guidance of a dermatologist. So, what are the various conditions that babies, toddlers, children, and adolescents are affected from? We all know they can have rashes, they can have hives, they can have fungal infections, warts, viral infections, bacterial infections, and acne. Dermatitis is also a very common condition, which means that the skin is inflamed at various places. The whole skin could be inflamed, or at partly various parts could be inflamed. It can occur at any age group. The skin becomes red, it becomes itchy, dry, flaky. Any age can be affected. So, what are the different types of dermatitis problems that we see in children? In very young children, less than a year old, you have cradle cap, in which you can see scabbing on the surface of the scalp. Brown colored lesions are present over the scalp, which people tend to scratch. This is not to be done. Use a very mild shampoo to get rid of them. Do not scratch them. And in case they are too much to handle, you should see a dermatologist. This is basically seborrheic dermatitis of the scalp, which occurs in young infants. Then we have eczema, commonly known as atopic dermatitis. These patients are again of varying age groups. Usually, it is seen that any of their parents, either of the parents or their family members, are affected and usually have asthma or skin conditions like atopic dermatitis or allergic rhinitis. These more prone to rashes, especially on the flex, the neck, face, abdomen, especially the diaper areas. Again, diaper rash could be because of the diaper contact in patients. It could not be associated with other area rashes. Then there could be contact dermatitis due to various lotions or oils which are used for these patients. Diaper rash could also be present in very young children because nowadays a lot of people use diapers for their kids. So first and foremost is you should avoid using diapers. The area remains wet and it's highly moisturized to prevent the growth of fungus in that area. So moisturization is a must. In case you really want your child to wear, these moisturizers should include zinc oxide and petroleum jelly in it to form a barrier repair, to form a barrier in that area and repair the diaper rash. In case it does not heal, you should show it to a dermatologist. The area should remain dry. Any kind of moisture in that area is going to increase the rash. Like I said, cradle cap is seborrheic dermatitis, and usually treatment is not required unless and until you fiddle with it. So you should not scratch these on the scalp, but use a mild shampoo to wash this condition. Other areas of eczema which are present on the body, they can be moisturized. The barrier function is disrupted in these patients, and a good moisturizer helps to retain the barrier, avoid the allergens which come in contact. The patient should not be bathed with very hot or very cold water. It should be lukewarm water. The main goal of treatment is to moisturize. So moisturize, moisturize, and moisturize to have a healthy skin so that the barrier of the skin is repaired. And in case the patient is not responding to moisturization, kindly show to a dermatologist, because any kind of itching in that area will increase the dermatitis or eczema in that area. Stay away from various allergens. These allergens could be perfumes, soaps, cleansers, paints, they could be medicines. They help in protecting the skin. So one treatment modality is prevention, and all these things prevent. Again, moisturizer is the mainstay in patients of atopic dermatitis. Patients or children are very prone to infections as well. The most common viral infections that are present or found in these children are chickenpox, measles, rubella, molluscum contagiosum, hand, foot, and mouth disease. So these are the common viral infections that a child has. Most of them are associated with fever, red rashes on the body, which are very itchy. The fifth disease, or the slap cheek, has a slap cheek appearance in which there is bright red rashes over the cheeks with high fever. Non-steroidal anti-inflammatory drugs are the treatment of choice. We can also give them antihistamines and use calamine for the patient. In case of high-grade fever, it's better to show to a pediatrician or a dermatologist. Again, we have measles, which again has red rashes all over the body. The patient has high-grade fever. Whenever you have rashes for more than 24 hours with fever, it is best to show to a dermatologist or a pediatrician in order to rule out whether the child is suffering from measles or rubella or chickenpox or any other viral or any kind of allergic drug reaction. Very commonly, it was seen that after post-COVID, the hand, foot, and mouth disease in children, it increased quite a bit. So we have fluid-filled lesions which are present on hands, feet, inside the mouth. Usually, it is a systemic disorder. Nothing is required. But in case patient is having difficulty in swallowing or is having pain or high-grade fever, it is best to show to a dermatologist or a pediatrician. Sometimes small, white, shiny dots or papules are visible on the skin, which are asymptomatic. These are, again, viral infections like molluscum contagiosum. They are self-limiting. The only issue is they are very contagious, highly contagious. So we should protect the child from getting reinfected on his own body, as well as passing on the infection to other children. So we should be aware that when such pink, pearly white bumps come up on the skin, you need to show to a dermatologist for proper treatment. They are usually self-limiting. They will not cause any harm, and the patient should not scratch them, and you should prevent the child from passing these to other children as well. In bacterial infection, most commonly you see impetigo, in which there is honey-colored crusts are seen, especially around the mouth, around the nose, or any other part of the body might be affected due to this. So antibiotic coverage is important. Usually creams are sufficient, but if they are recurrent, then we need to take oral medication for this. Fungal infection is also very common nowadays, and it has been seen that most of the times adults in the family have these fungal issues. So it is very important that if your child is suffering from this, you should go to a dermatologist for proper treatment, as well as see to it that the other adults who are in the family, they do not have it. And in case they do, there's simultaneous treatment is also required. Otherwise, we will pass on the fungal elements to the child, and again the child will be infected because of this. Face is a very common area in which these children get these ringworm kind of lesions, which are round, well-defined lesions, and they are intensely itchy. Urticaria is again mosquito bite-like lesions, larger in size, intensely itchy. Children might get it. And usual causes are eating outside food or junk food. So this is to be prevented in such children. Antihistamines are the treatment of choice. Very commonly, we have seen that kids bite their nails, and we think that it is probably normal, but it is a psychological disorder and it needs proper treatment. So biting of nails, plucking of hair, these are psychological issues that should be catered to and seen into, and they have treatment. So I think this aspect, the psychological treatment, also needs to be dealt with. Many a times we have seen that children, they lick the walls, they eat mud, they eat dust, they lick here and there. So this also has certain implications that the child is probably suffering from iron deficiency anemia. This is known as pica. And so we need to increase or take care of the health of the child by increasing his iron supplements or giving him foods which are so that this can be taken care of. Kids can also have acne because the hormones which are transferred from the mother to the child, they are normally seen on the cheeks and they go off on their own. Usually is required. Otherwise, for adolescents, acne are very common and dandruff is one of the major reasons for it. So if we control, usually the acne also get controlled. Again, dandruff also a common condition in children. So anti-dandruff shampoos are of great help, both in younger children as well as adolescents. And they can be used freely. They are available over the counter. But in case the dandruff cannot be controlled because of these, we should think of certain other skin conditions also, like psoriasis, which could be seen in children. Any kind of skin infection in children should be dealt with. It should not be ignored. And none of the creams or medications should be used by adults for their children. This is a very important point. Please understand that you are using medicines. They might be harmful for your child. So it is a request to all of you not to use medicines which include oral medications as well as creams in your children. In case your child is suffering from skin issues which are of long standing or more than 2 to 3 days, kindly see your pediatrician or your dermatologist for better treatment. I think health comes from within. So if we eat healthy, our skin will automatically become healthy. Diet plays a very important role. So your diet should be rich in multivitamins. It should be rich in green leafy vegetables, fruits. It should be rich in proteins, which we get from pulses in case of vegetarian people, and which we get from meat sources or egg. So a healthy diet is very important. Roughage is very important. I think overall holistic health comes through all these good skin habits, like oiling your skin, using good shampoo, which is SLS free, paraben free, and moisturizing your body well. Hope you stay healthy. Thank you.